Hello, my friend. I wanted to spend a few minutes with you concerning the concept of inflammatory POTS. Yes, I was the one to come up with that term, but you'll be hearing more and more about it as information is released. Looking back on my journey, I took ibuprofen almost every day when I first became sick. I remember pausing one day and asking myself why I was doing that. I didn't know. It just felt like I had inflammation. At one point, I put a pillow in my car to lean on when I was driving. A friend asked me what that was for, and I had to say, I don't know. I just felt like I needed it. Not unlike many of you, my body figured out it was dealing with inflammation long before anyone else did. Even at my worst, though, when pain was bad and an MRI even picked up a great deal of inflammation, no one knew what to do with it without a label. That was such a frustration for me because I didn't have a label. Although I was diagnosed with EDS, Ehlers-Danlos syndrome, that's considered a non-inflammatory condition. That diagnosis didn't help me at all with getting proper care, unfortunately. We're not all alike, of course, and we need to consider that everyone is different. But we can look at some symptoms to get a feel for what's going on. Non-specific inflammatory symptoms can include pain, flushing, food sensitivities, headaches and neck pain, fatigue, increased sensitivity to most any chemical in the environment, the inability to handle heat, and the inability to handle most any stress. When someone develops POTS and has had the regular causes ruled out, such as a heart problem, some neurological diseases, etc., we can consider the possibility that the POTS is a cardiovascular response to chronic inflammation. Is this a unique concept? No. In fact, when you get the flu, the resulting inflammation can cause a cardiovascular response. We can get tachycardia. I know the last time I got the flu, my resting heart rate of 110 beats per minute was what first clued the doctor in, and the fever and then the positive flu test confirmed it. This cardiovascular response doesn't appear as subtle, but it's difficult, if not impossible, to confirm with testing. When you have the flu, you don't need to fight for validation, but when you have undiagnosed chronic inflammation, you're left without a label and without validation from your doctor, what is devastating to us all. The inflammation then causes more problems than just the cardiovascular issues, and that's when we start to appear as hypochondriacs to our doctors. How can we have so many different symptoms involving so many different systems of the body, right? I'm here to tell you this is real. This is brutal on us, and yet we can get better. In every case, we need to consider conditions that can cause or worsen inflammation. At POTS Care, we do a deep dive on every case to get you the answers you need. I remember when I was sick, being in bed, surrounded by four walls, and yet seeing people with significant illnesses like lupus or rheumatoid arthritis going to work, dating, and having a life. I thought, how can they do that? They can do that because they have medications and supplements to help them with their underlying problems. I remember wondering if we could locate the underlying problems. Could we use existing medications or supplements to achieve something similar? Is a normal-ish life even possible? You know I was on a mission to figure it out. Let my recovery and that of my children be a testament to you that it is absolutely possible not only to recover from POTS, but to go on and lead a normal and fulfilling life. It wasn't an easy journey for me or my kids, but it was worth every step. Please keep moving forward, my friend, and know that someday we won't need to fight so many battles. Know that for this one, though, I'm right here with you.